Well, back with Dr. Melnick. Dr. Melnick, we've talked about that missing teeth really can create havoc. Not only do you chew not so good, and by doing so can get your stomach upset, don't get the nutrition in it. And I know many of us don't pay enough attention to it. I, for instance, start eating with my wife a steak, and she's barely finished chewing the first bite. I'm done with the steak, and and I do have all my teeth. So some of us cannot be helped, I guess. But at the same time, it creates headaches, it creates tensions, it can do all kinds of things, even sleep apnea, not getting enough oxygen. But so a person has missing teeth. What are the current options to fix that? Because what most of us don't realize is that dentistry has improved in technology just literally as much as a computer, or so. It might not be as visible, but it has come a long way. So can you shed some light on what we can do when we have a missing tooth or two in our mouth?
Sure, absolutely. Well, let's talk in simple terms. There's two basic categories. You can have a replacement tooth that's removable. We'll call that a removable bridge or a partial denture. Or you could have replacement teeth that are not removable, that are fixed in the mouth. On the fixed options, you could have teeth that are connected to your natural teeth. We call these fixed bridges. So you can actually reduce the size of the neighboring teeth and connect a series of teeth together to replace the missing ones. That's one way to go. Or you could have man-made titanium surgical screws, what we call implants, placed in the jawbone to act as man-made tooth roots, and you can attach teeth directly to those implants.
Okay. So we have three versions, and obviously the first one about something removable, well, that kind of like reminds me, and probably most people, of grandma's dentures, and that doesn't sound too, too advanced. It doesn't sound like something one really wants, except for maybe a day or two while going to a wedding or so, maybe, I don't know. Let's usually what limits someone to the removable option is either it's a temporary service, we're doing something more sophisticated, but we're allowing things to heal, right, or financially they may be limited in what they can afford. Okay, all right, and that's understandable. And all those things do need to be put into consideration, since on an average, doing something is better than doing nothing.
Absolutely.
Yeah. So let's go to the fixed crown, which has been around longer than the implant thing. Give us some fast overview for on a layman's view, like some of the advantages, disadvantages, or some of the time when a crown a bridge is kind of like the more logical way to go rather than an implant, or shade some tell us a little bit about it.
Sure. My basic view is if you're missing, let's say, a single tooth, mm-hmm, and the two teeth on either side of that missing tooth have large fillings, and the remaining tooth structure is weak, I think it makes sense to do a fixed bridge. You can then get two benefits. You will restore the biting strength of the two neighboring supporting teeth, right, and you're able to get a replacement tooth in the middle. Mm-hmm. However, if the tooth on either side of the neighboring teeth, let's say, are perfectly fine, they have no cavities, no filling, nothing wrong, why would you want to drill away healthy tooth structure in order to replace a tooth when you could put an implant in the jawbone and not touch the teeth on either side? So, to me, that's the easy way of looking at it.
Got it. Now, there still probably is a little bit of a money consideration either way. I've heard that
for a single tooth implant versus a bridge, it's roughly the same. You're not saving a lot of money. It gets more costly when you're talking about multiple implants. Maybe the patient doesn't have adequate bone support, so now you have to add bone to their mouth. That's when things get a little bit more costly. Perhaps where you want to put the implant, you have to build up the ridge either by widening it, or maybe one of the air spaces called the sinus is too far down. You have to raise or make the sinuses smaller. That could add to the cost of the implant treatment, but that's decided on an individual basis.
I got it. So let's, however, since sometimes, let's just say a person, it makes sense to me that an implant in itself isn't all that much more expensive, since you only fiddle with one tooth and otherwise you fiddle with three teeth. So you have three crowns or caps, as we call it, right?
Right.
With no doubt. But let's look at something else. Let's say a person needs two teeth in it or two implants, so basically has a 4-unit bridge. Let's look at the short-term cost a little bit versus the long-term cost, because that seems to be quite interesting. So tell me, a bridge, a fixed bridge, where all the teeth, let's say 3 or 4 of them, are basically welded or melted together, and you can't really floss in between. And I have heard that creates some problem with, again, maybe more slappy and lazy people like me, where they will simply not go through the hassle it takes to floss those teeth correctly, and thus they get gum disease problem, bone problem, and actually lose that bridge much faster versus the implant. Is there some truth to that?
Well, you can floss under a bridge. It is more challenging. And,
Right.
you know, the human nature is, if it gets more complicated, I'm not going to do it as often. So there is some truth to what you're saying. But I look at it from a different point of view. The longer the span of a bridge, the more you're asking the supporting teeth to support the missing teeth. From a functional point of view, you know, that's not ideal. If I have a long span of missing teeth, I would like those implants in there for 2 reasons. One, I'm going to have more predictable results long term, in that I'm going to be defining the support on the missing teeth directly in the jawbone instead of actually having neighboring teeth very far apart supporting it. Secondly, when you have a long span, by placing implants directly in the bone, you're going to maintain that bone. In other words, when you don't have teeth sticking out of the jawbone, the bone that's underneath the false teeth is going to weaken over time. And we know that osteoporosis is a problem that people are concerning themselves with as they get into old age. By having implants and having function of the teeth with the implants directly in the jawbone, you're going to have a more unlikely course of osteoporosis or bone weakening.
Wow. So this bone weakening thing is an interesting factor, because we see it happening very heavy with people who have a full denture, our grandparents, right? And they all look a little caved in, like a dried out tomato. Basically, and that comes apparently from the shrinking of the jawbone. So what you're saying is a small part of the jawbone can also shrink, and actually puts a few years on the way you look.
Absolutely. You know, what you're talking about is, again, what I was trying to illustrate before. It's like, let's say, Helmut, God forbid, you got sick, severely sick, you were in the hospital, and you had to stay in the hospital bed for a month. Your muscles would get weak from lack of use.
Right.
Well, when you have teeth pulled, the same thing happens. If you don't have anything sticking directly in the jawbone, the biting forces are displaced laterally, not into the bone gets weak, which is why a denture may fit beautifully today, but 5-10 years down the road it gets loose. The denture didn't change, the patient's jawbone did. Same thing happens if you have a portion of the jawbone where multiple teeth are missing. Even though you may have a long span fixed bridge, the bone in between those, the teeth that are supporting the bridge is getting weaker and weaker over time.
Wow. So not only can a dentist, perhaps heavy contribute to not having headaches and other tensions and things like that, you now actually, without doing plastic surgery, by just keeping the bone the way it's supposed to be, can make a person look better. And none of us, whether we are 50 years old guys or 20 years old girls, I don't think nobody really minds looking his age all that much. But what we do mind is looking older than we really are. And a caved-in face because the bones start disappearing would definitely do that. Dr. Melnick, very, very super interesting people watching these videos. I'm sure they learn a lot, and because that's the thing we don't think about. We go, okay, my teeth are in it, I'm all right. I don't necessarily need a Tom Cruise smile and all that type of stuff, and that may all be true, but there is things working below it, and next thing you know is we have to go to a facelift, to a plastic surgeon. Of course, we then quite often don't do that either, and we just don't look so good. And because it comes slowly, we probably don't notice it. It's the other people who notice it that we are obviously starting to look old. Not a good thing. So that's one of the more reason to put in an implant, is what you're saying, because it replaces the root of the tooth, and by doing so stimulates the bone, puts pressure on it, does what it does, whatever that might be, but keeps the bone the way it is.
Absolutely.
Dr. Melnick, thank you very much.
You're welcome, Helmut.